Less than 300 days to the end of the Millennium Development Goal targets, on to reduce by 3/4 the maternal mortality and by 2/3 the under-5 mortality ratio. But both maternal and infant deaths still remain unacceptably high in Uganda. Teenage pregnancies remain a major cause of deaths of girls between 15 to 19 years, while 60% of child deaths is attributed to malnutrition. So what should we be doing right? To help us answer this question is World Vision Uganda's Child Health Now Coordinator, Esther Nasikye. You're most welcome to the studio, Esther.
Thank you, Sheila.
Now, how bad is the problem?
You know, it is so bad, I must say, because if in our country 16 mothers are still dying every day, you could imagine a taxi of women, all women, including the driver and the conductor, crashing every day. That is how bad it is. Or we talk about the number of children that are dying under 5 being 282 according to the Uganda Demographic Health Survey. That is almost the population of some schools. But of the 282 under 5s who are dying, 106 are actually newborns who are maybe dying because there's no equipment to resuscitate them when they are, born with what we call birth asphyxia. So these are preventable. That's why we are saying the situation isn't good.
We just left with 300 days to that Millennium Development, to the end of the Millennium Development Goals. Where are we not doing, what are we exactly not doing right? How come we've not hit this target and we still have those numbers that you just talked about?
You know, you're right, because you see the issue with healthcare is that we need the involvement of many stakeholders. It is not only the role of government. It is, civil society needs to come in. We need to see the community members themselves coming in. We need to see parents, because, the people that are dying are mothers that have faces, they have names. The children that are dying are children, so we need to think beyond mere statistics. So we need to look at community involvement. If we say the mothers are dying because of birth-related complications, but our husbands taking their wives to deliver in the hospitals, our parents ensuring that their children are fully immunized so that we don't have children dying from preventable causes. How about food at the household level? Is there enough food? Are children being fed? Because why do we have the 33% of under 5s being stunted, or malnourished? There's a problem, but it starts even at the household level. But then when you move higher, we are saying we need to have critical cadres of health workers like midwives. We don't have enough midwives in the country. So even when we talk about exporting somewhere, saying, please, before you export, let us have enough at home.
Esther, I would like to bring to your attention some statistics, which you probably are familiar with. Teen pregnancy is the #1 cause of mortality for girls between the ages of 15 and 19 years. 24% of women aged 15 to 19 are already mothers or pregnant with a first child. Have we tried to address the root causes of this problem?
The government has tried, because by introducing the universal primary education, at least they're trying to help a girl to stay in school. And we also know that when a girl stays in school longer, then definitely she will not get married off early. But then there are challenges between the home and the school. There are girls who are not going to school because of simple reasons, like they cannot afford sanitary towels. So when it comes to that time of the month, they cannot afford to go to school. And before you know it, they've dropped out of school, and by the age of 16 or 17, some of them are pregnant. But then also there are structural issues, so that we need the government to look into. What do we do with these high numbers? Do we have, the police environment? Or even our districts, can districts start talking about bylaws with regard to teenage pregnancies and all?
Yeah, now so very briefly, in 30 seconds, our time is fast spent. What next for the advocates of maternal health?
One, we think we need to increase community accountability, because the government makes promises, like by 2015, the number of mothers dying will be 0. But how are we involving the community in holding the leaders accountable, the people that make the promises? That is fundamental. But also recruiting critical cadres like midwives is very important to save the lives of our mothers and children in this country.
Esther Nasikye, thank you.